Depending on what literature you want to quote, it's estimated that 40% of patients with persisting back pain have damage to an intervertebral disc. Intervertebral disc is a soft tissue structure under very high pressure, sitting in a hard place between two vertebrae, and it's very prone to tearing and rupture. And there can be different degrees of these kind of problems. You can have simple dehydration, where the disc simply desiccates. This happens with age and time, and is not necessarily a pathology and doesn't necessarily cause pain. The next degree of change in the intervertebral disc might be simple bulging of the disc. So instead of having a crisp posterior contour, the disc sags a bit and may bulge. Now, this is a difficult situation to judge from MRI scanning. When you test simple bulging intervertebral discs for pain, in patients with back pain, I have to add, about 50% of them are likely to be painful. And you can't tell that from an MRI scan. So this produces a great deal of confusion in the everyday diagnosis and management of patients with back pain, particularly in non-specialist hands. Because and both mistakes happen. The changes can be overinterpreted and the changes can be underinterpreted. Beyond this, you can have discs which bulge and which show physical tears, and these are visible on MRI scanning, and these are highly likely to be generating pain. And finally, you have what's called a slip disc, where the back of the disc, or the annulus as it's called, tears, and the disc nucleus, the central area, the central material, ruptures through the annulus and pings into the back of the spinal canal, hits a nerve and causes sciatica. And this is classical slip disc sciatica.